Why should most diabetic patients consider using milk thistle? Yes, you heard it right. Why should most people with diabetes consider using milk thistle? This is not just an ordinary herb, but a silent partner that can change the game in blood sugar control and liver protection. In the US, milk thistle has been used for centuries to support liver function, but recently, it has been drawing more attention from endocrinologists and diabetes experts due to its ability to reduce insulin resistance, help detoxify the liver, and naturally improve blood sugar levels. You'll be surprised to learn why it is so effective and how to use it correctly to maximize its benefits. And don't forget, like, share this video, and subscribe to the channel now so you don't miss out on scientific tips to help you naturally, effectively, and sustainably manage diabetes. Let's get started. 1. What is milk thistle? As mentioned earlier, milk thistle is not a magic cure, but it can serve as a powerful ally for the liver and pancreas, two organs that play crucial roles in blood sugar control. Particularly for diabetics, maintaining a healthy liver is the foundation for improving insulin sensitivity and preventing dangerous complications. So, what is milk thistle that makes it so highly regarded by endocrinologists? Milk thistle, scientifically known as Silybum marianum, is a herb with purple flowers, distinctive white veined leaves, and has been used in traditional medicine for thousands of years, especially in Europe and the Mediterranean region. However, it is only in recent decades that modern scientists have started researching its biological effects in depth. The most prominent compound in milk thistle is a group of flavonoids known as silymarin, which makes up about 70 to 80% of the extract from the seeds. This powerful antioxidant helps protect liver cells from damage caused by free radicals, toxins from food, medication, alcohol, and environmental pollutants. In other words, silymarin acts as a biological armor that shields the liver from external attacks and supports the regeneration of new liver cells. Additionally, silymarin has been shown to have anti-inflammatory properties, improve glucose metabolism, and reduce fat accumulation in the liver, key factors related to type 2 diabetes and metabolic syndrome. Thanks to these properties, milk thistle is gaining more recognition in the medical community for naturally and safely supporting blood sugar control and liver function improvement. Understanding the characteristics of milk thistle is the first step to using this herb properly and effectively. But how do you use it in the right dosage and manner? Next, let's explore how milk thistle supports diabetics and why most patients should consider using this special herb. First, let's talk about the liver. 2. Why should diabetics care about their liver? After understanding what milk thistle is and why it is considered a biological shield for the body, it's time to dive deeper into one of the most important reasons why this herb is recommended for diabetics: the role of the liver in blood sugar control. You might think that blood sugar control primarily involves the pancreas, the organ that produces insulin. While that's true, it's actually the liver that plays the primary role in regulating blood glucose levels, especially during times when you're not eating, like at night or between meals. The liver stores glucose as glycogen and releases glucose into the blood when the body needs energy. However, if the liver is damaged, fatty, or chronically inflamed, this function becomes disrupted, leading to prolonged high blood sugar levels. An alarming fact is, nearly 70 to 80% of people with type 2 diabetes also have non-alcoholic fatty liver disease, NAFLD. This is a form of fat buildup in the liver unrelated to alcohol consumption, mainly caused by a diet high in starch, sugar, and a sedentary lifestyle. Fatty liver increases insulin resistance, making it harder for the body to use insulin effectively, and this is the root cause of type 2 diabetes. So, how does milk thistle help in this case? Supports detoxification and reduces fatty liver, thanks to the active ingredient silymarin. Milk thistle promotes detoxification in the liver, while preventing the accumulation of new fat and helping to reduce existing fat. As liver fat decreases, liver function improves, and the body can regulate blood sugar better. Improves insulin sensitivity. Some studies in both humans and animals have shown that silymarin can help increase the sensitivity of cells to insulin, thereby supporting natural blood sugar control without relying entirely on medication. Powerful anti-inflammatory and antioxidant effects. Diabetes is a condition that involves chronic inflammation. Silymarin helps suppress inflammatory responses at the cellular level while neutralizing free radicals that cause tissue damage. This helps slow disease progression and protects vital organs like the liver, kidneys, and eyes from complications. In simple terms, if you have diabetes but haven't given proper attention to your liver, you're missing a key link in the treatment process. Taking good care of your liver opens up opportunities for better disease control, less reliance on medications, and long-term health. In the next section, we'll discuss how to use milk thistle correctly, what dosage is appropriate, which form to use, and what precautions to take when using diabetes medications. 3. How to use milk thistle. As discussed in the previous section, milk thistle is not only a herb that protects the liver but also plays a role in supporting blood sugar control by reducing insulin resistance and fighting inflammation. However, to maximize the effectiveness of milk thistle, proper usage and dosage are crucial. First, you need to know that the active compound responsible for milk thistle's benefits is silymarin. Therefore, when choosing a supplement, do not just look for the name, milk thistle, on the label, but also check the content and the silymarin extraction ratio. The common dosage recommended by experts is about 1.000 milligrams of silymarin per day, divided into 2 doses, preferably after breakfast and dinner to increase absorption and reduce gastrointestinal irritation. This dosage is considered safe and effective in many clinical studies, especially for those with fatty liver or type 2 diabetes. As for the forms of usage, milk thistle is now available in various forms to suit individual needs. Capsules. This is the easiest form to use. Convenient for busy people, most high-quality products clearly indicate the standardized silymarin extraction ratio, typically 70 to 80%, ensuring consistent effectiveness. Powder. This can be mixed with warm water or added to smoothies, however, you need to be cautious about the source and the correct dosage. Herbal tea. While it may create a relaxing feeling, the silymarin content in tea is often low and difficult to control, so it is less commonly used for therapeutic purposes. In summary, if you are looking for a way to incorporate herbs into your diabetes management regimen, milk thistle is a worthy option, but start by choosing a reputable, standardized product and use it regularly according to the guidelines. In the next section, we will discuss important considerations when using milk thistle alongside diabetes medications to avoid side effects and achieve optimal results. 4. Precautions when using milk thistle. After understanding how to use milk thistle and the appropriate dosage, there is one crucial aspect that you should not overlook: safety precautions. Especially if you are treating diabetes with medication or insulin. Although milk thistle is considered one of the safest herbs and is widely used in many countries, this does not mean that it can be used indiscriminately without monitoring or considering the medications you are taking. The first thing to remember: milk thistle can lower blood sugar by enhancing insulin sensitivity and supporting glucose metabolism. This is a positive benefit, but for those taking diabetes medications like metformin, insulin, or sulfonylureas, this combination may lead to an increased risk of hypoglycemia, low blood sugar, if not closely monitored. Therefore, if you start using milk thistle, make sure to check your blood sugar more frequently, especially in the first 1 to 2 weeks. If you experience symptoms of low blood sugar such as fatigue, shaking hands, cold sweats, or rapid heartbeat, stop using it and consult your doctor immediately. Your doctor may need to adjust your diabetes medication dosage if your blood sugar levels consistently decrease after using milk thistle. In addition, pregnant or breastfeeding women should exercise extra caution, although there is no evidence showing that milk thistle harms during this period. Due to the lack of absolute safety data, it is best to consult a doctor before using it. Another point to note: if you are using multiple supplements, vitamins, or other herbs, make sure to check for interactions to avoid active compounds competing with each other or reducing their effectiveness. In summary, milk thistle is an effective ally, but to maximize its benefits without risk, you need to use it smartly, carefully, and with thorough monitoring. In the final section, we will summarize the key points and emphasize why this herb deserves a place in your diabetes management journey. 5. Don't treat milk thistle as a magic cure. We've just discussed how to use milk thistle safely and effectively. However, there is an important point that must be clarified from the start: milk thistle is not a magic cure. This is a supportive herb, not a miracle replacement for a healthy lifestyle and disciplined eating habits. Many people, after learning about the benefits of milk thistle, have overly high expectations, thinking that simply taking a few pills daily or drinking milk thistle tea will erase the consequences of poor eating, insufficient sleep, or lack of exercise. This is a misconception and a dangerous mindset. Milk thistle only achieves its maximum effectiveness when combined with a low-carb diet, healthy fats, and good proteins, along with regular healthy habits, enough sleep, stress reduction, and regular physical activity. If you continue to eat sugar, drink soda, consume fast carbs, and bad fats every day, even regular use of milk thistle won't reverse liver damage or insulin resistance. Think of milk thistle as a reliable ally, a companion that helps restore liver function, support metabolism, and enhance the effectiveness of your diabetes treatment. But you are the main character in your diabetes control journey. No pill or herb can take over your responsibility. Instead of expecting miracles, begin with specific actions and discipline every day. Eat properly, sleep well, exercise moderately, and use natural remedies like milk thistle scientifically. That's the only way to regain control of your health and live healthily with diabetes. If you are ready for a change, milk thistle will be a trusted companion on that journey. But the change starts with you, right now. Conclusion: milk thistle is a reliable and useful ally for people with diabetes, especially those facing fatty liver or difficulties in controlling blood sugar. With its main ingredient, silymarin, milk thistle offers numerous benefits, including liver protection, anti-inflammatory, antioxidant effects, and improving insulin sensitivity. All these factors play an essential role in supporting diabetes management and overall health. The key is that milk thistle is not a miracle that can replace a healthy lifestyle. It is just one part of the recovery and healthcare process. A balanced diet, regular exercise, and stress management are the foundations for achieving long-term and sustainable results. Milk thistle will be most effective when used correctly, combined with positive lifestyle changes. Remember, you are the ultimate decision maker in your journey to beat diabetes. Milk thistle will be your supportive companion, but you are the one who must take control of your life and health. Start today by taking action for your health and continue to maintain positive changes to live a healthy and energetic life.